Thank you, Stefan, for joining us today.
Absolutely.
Now more than ever, we're seeing so many health professions experience burnout. So what have you seen work to combat that for nurses?
This is something that comes up a lot. It's a hot topic because retention's important. I think the first step is acknowledging it, because with all that talk, a lot of people discuss it and will say, I feel burnt out, but rarely, if ever, do I hear someone say, I'm suffering from burnout. Because saying that you're burnt out, it's kind of like, maybe it's something that's gonna pass and you'll feel a little bit better the next week, you won't be so burnt out, right? But if you say I'm suffering from burnout, that's more of kind of a statement saying, there's something in my life that's a big part of my life, which is my career. It's no longer making me happy, and it could be causing troubles in my life. And that's a much, much bigger problem.
So how do you address that?
Today I would address it a lot differently than I would say several months ago. In my personal experience, what worked for me was I kind of, thought about what changed. There was a time in my life where I really loved nursing. I really loved what I did. And the job didn't really change all that much, relatively speaking. So I thought, well, maybe it was something about me that changed. And so I started to kind of assess myself and my behaviors. And something I noticed was that when I really got into nursing, when I started, one of the things that got me the most excited was patient interaction, right? And so I remember sitting next to, my patients and having long conversations with them. People would be like, where's Stefan, right? And I'd be in the room. And so I realized that as time went on, I'd start spending more and more time in the break room, any free time I had, or at the nurse's station where, a lot of times there's gossip and negativity, which, isn't all that good for the psyche. And so I kind of decided, okay, I'm going to give this a shot. So several years into my career, I said, I'm going to go and sit with my patients. And it was unbelievable the change that happened. There were obviously days where I had no time to have any sort of break. Whenever I did get free time, I would go and I would sit with my patients. We would have conversations. They loved it. It made me happy, and that's one way to remedy it.
So what if nurses try to do what you did and they're still feeling that burnout? What can they do next?
Exactly, yes. So if you do think back to what, really, really inspired you and got you into nursing, you go and give that a shot again and that doesn't help, you can kind of do what I did.
Mm-hmm. And what's that?
Well, anyone that follows me on social media has seen what I do and knows that I have a blast doing it. And that's essentially taking my passion outside of nursing and combining the two. And so for other people, they're gonna have different passions, right? Whether or not it's crocheting, playing the guitar, I don't know, whatever it is that you love, try to infuse that into nursing. So say videography is kind of your thing, like it was mine. Do what I did. There's room for plenty, right? If playing the guitar is your thing, write songs for your patients, the kids, the parents, those that are passing away, the families that are experiencing these traumas. I mean, be a rock star and having such an impact, a profound impact on these really, really memorable experiences for these people. If you're into crocheting, then crochet a
baby blanket,
sure, yeah. For the unit or, for anyone on the unit or for someone's, child, but whatever it is. But try to take something, your passion outside of work, shine that light into nursing the only way that you can really shine it.
So that's a great tactic in terms of finding something outside of nursing. But what if that doesn't work? What do you suggest people do next?
Yeah, so if that doesn't work, honestly, there's 1,000 different specialties in nursing. Go shadow, try something else, try on a different pair of scrubs, see how that works.
And you said that this is your, standard go-to recommendations where things are normally challenging, but what about these times where we're in a COVID-19 crisis?
Yes. Now, a lot of these things sound unrealistic, right? Not enough time to do it. Is there any time I can sit with my patients? Absolutely not. I've got 10 of them on IV drips, on ventilators. This is crazy. Now is not the time for me to be tapping into my nursing school roots, right? You got to think about burnout a little bit differently. It's not that this job has taken its toll on me over the long period of time. It's like, I can't make it through the first 6 hours of my shift kind of burnout. So I really think it's about meeting the basic needs that we talked about before. Advocating for yourself to clock out on time to get that sleep because it's absolutely necessary. Trying to get your breaks as much as you can. Eating appropriately, getting enough nutrition, enough sustenance, and and then at some point you may want to look into getting another job, honestly, because you never know what's waiting out there for you until you go look. I feel like a lot of people feel stuck where they're at.
And what about spirituality? What are your thoughts about that?
Yeah, spirituality is extremely important to me, and I'm glad you asked. If someone that's watching is saying, I got no time for any of that, and I'm sure there's plenty of nurses saying that, whatever time you do have, whether or not it's 10 minutes in the break room to close your eyes, or it's 20 minutes before bed, strengthening whatever spiritual connection you have, making that inner peace uninterruptible in any way that you possibly can, it takes time. Reading, understanding, but it's so worth it because in the devastating times that we're in right now, at some point, that might be the only thing that we got.
Well, thank you for taking the time to talk about something that could be a very personal subject. Spirituality can mean many things, and encouraging people to explore that for themselves. So thank you for talking about how that is connected to preventing burnout. So stay tuned, everyone, for our next self-care tip.